Children are particularly at risk for and are highly vulnerable to heat illness, and the reasons are that children produce more heat and they don't sweat nearly as much, and they're quite frankly not aware of their risks of heat exposure and heat illness. The first of concern would be heat exhaustion. Those symptoms would be feeling faint, developing headaches, developing muscle cramps, nausea, lightheadedness. When a child begins to develop those symptoms, what needs to be done is remove them from the heat, put them in a cool place, and give them lots of fluids to drink. Those symptoms should generally resolve within about 30 to 60 minutes after this is done, and if they don't, then they should seek medical attention. The much more concerning heat illness is called heat stroke. Heat stroke is a specific condition that would develop with either prolonged or excessive heat exposure. If a child begins to present with a very high temperature, not sweating, altered in their mental state, they need to immediately be removed from the heat and brought to medical attention right away. In conditions of high heat and high humidity, it's really quite essential that children drink plenty of fluids. A way to prevent heat exhaustion is a good rule of thumb to follow is drinking at least a half a glass of water or a sports beverage every 20 minutes. Doing this will again minimize the risk of developing heat exhaustion, but frankly it will also be great to keep them energized and healthy and more active. I would recommend that parents use sun lotion that has an SPF of 30 or greater, and they apply it to their child about 15 to 20 minutes. First application should be applied about 15 to 20 minutes before they go out, and they reapply it every couple of hours while they're exposed to the sun. And definitely reapply it if they're in a situation with lots of sweating or swimming. Well, summertime is of course a time that children will be outside and will want to take advantage of being in water. I think a few things that are really important to recognize is one, it only takes a couple of inches of water for a young child to be at risk to drown. And in the pool where there's lots of activity and lots of kids, it only takes a split second for a child to go down, be unrecognized that they're in danger, and to be at risk for drowning. Head injuries count for more than 60% of bicycle-related deaths, and wearing a helmet will prevent more than 75% of bicycle-related deaths from head injuries. So wearing a helmet is just the start. Proper fitting of the helmet is essential to ensure that by wearing it correctly, the risk of injury is minimized. Another particularly important consideration in hot weather and humid weather is air quality itself. So if you're aware that the air quality is going to be particularly poor and meaning greater than a code orange day, you should probably keep those who have risk for respiratory illness, such as asthmatics, out of the hot weather.